All right, hello everyone. My name is Tiara Brooks from SchoolBased Health Alliance, and we would like to thank everyone for attending today's webinar titled Providing Access to Vision Care for Students, a three-tiered approach. This webinar will help you learn more about the three-tiered approach to providing access to vision care for students, knowledge of school-based vision center blueprints, and additional resources. But before we begin, we do have a few housekeeping reminders. First, if you would please help us with our attendance count. If you are viewing as a group, please go to the chat window in the question box and type in the name of the person registered and the total number of additional people in the room. For example, Tammy Jones +3. This will help us with our final attendance count. Also, attendees are in listen-only mode. However, we want to hear your questions. To ask a question at any point during the webinar, please use the question box located in the GoToWebinar control window. We will address questions during the presentation and after the presentation. At the end of this webinar, attendees will be asked to complete an evaluation poll questions. Please let us know how we are doing. Your feedback is vital in helping us craft presentations that will meet your needs. This webinar is being recorded and will be archived on our website in 3 to 5 business days. Please also visit SchoolBased Health Alliance for additional archived webinars for topics such as the ones you are viewing on your screen. While you are on our website, please take time to read about our membership. The SchoolBased Health Alliance works to improve the health status of children and youth by advancing and advocating for school-based health care. Our members extend and support our work. We ask that you please join us. We offer 2 options for membership, individual or organizational. Our members receive exclusive access to valuable program tools, timely publications, and networking opportunities. Please take a moment after the presentation to visit our website for additional membership information. I now would like to introduce our presenter today, Ms. Lisa Kirkaruto. Lisa has spent the past 4 years working on sustainable initiatives in West Africa. 2 of these years, she was focused primarily on launching sustainable vision care solutions in the Gambia with one site. In December of 2015, she brought her skills back home and took on a leadership role for school-based vision centers in the U.S. Lisa currently lives in Kentucky and works out of One Site's offices in Mason, Ohio. Before I turn it over to Lisa, we would like to invite everyone to participate in our first poll question. We would like to know who is joining us today. So if you can please answer the first poll question, what type of provider are you? If everyone can just take a few minutes to answer the question. Thank you. Thank you, everyone. We see about 57% of you are other. If you can please take this time to also enter in the question box, what type of provider are you, or what position of you are you for joining us today? If you can please enter that in the question box, we really appreciate it. I would now like to introduce again our presenter for today, Lisa Curcaruto.
Hi, thank you so much, Tiara. Thanks for having me on today. Hi, everyone. I really wanted to start out this presentation. Whoops, and just made the presenter right now. Give me a second. Show my screen. All right, I'm going to give that 1 second to make sure that everyone can see my screen. Tiara, can you see my screen all right?
Yes, I can. Thank you, Lisa.
Fantastic. All right, so I really wanted to start out this presentation today with some numbers. In 2015, Deloitte Consulting and OneSight conducted a study around the size of the vision care crisis. What turned out that actually about 1.1 billion people in the world are in need of refractive error services but lack access. This number, for those of you who read it this week, correlates very well with a new study published by IAPB and the Brian Holden Institute that states that by 2050, 5 billion people will be myopic or nearsighted. This is a huge number, and when we're talking about access, I just want to let you know what we really mean. Access is a few things. It could be a lack of quality vision care within a certain geographic area. It could be a lack of providers bringing services at a low cost. It could be a lack of transportation. It could be an area with lower economic means, with families not having the ability to take time off work to visit a doctor. I think this is something that hits very close to home for many of us. So an example of this is, for instance, in the United States, a child may be insured under Medicaid or CHIP, but as you all know, finding a doctor in the area that has an appointment time available for a Medicaid patient can be very difficult. The available appointment may be at 2 p.m. on a Tuesday, a time that we all know is very difficult for a parent to take off of work, locate transportation, and get their child to that appointment. This is a huge problem because here in the U.S., we know that 80% of student learning is visual, 80%. Yet 1 in 4 students in the U.S. has an undiagnosed vision problem. Even with visual acuity screenings at schools, less than 1/3 of the students referred to eye health professionals actually ever make it to the doctor. This is massive. Almost, from the poll question, I don't know exactly where everybody is coming from, but I think most of us on this call either work with schools, interact with schools, have our children who are in schools. You've all seen children, you may have been one, that seem lazy, they may have seemed uninterested. Of one, if not two, maybe all of these. There's Voucher Programs, New Eyes for the Needy, Vision USA. There are also charitable clinics supported by many groups like the OneSight Charitable Clinics, different programs throughout the United States, or the Esseler Foundation. And then there's Sustainable Vision Care Clinics, which are beginning right now, and they really have the opportunity to work with a broad range of operational and supporting partners across the United States, incorporated into the school-based health center to really fulfill that comprehensive care. So these 3 programs are what we call the three-tiered approach. And let me explain a little bit more about how this three-tiered approach works. So the best way to look at this is via the School-Based Health Alliance mapping tool. If you can, I'd really advise everyone to check out the mapping tool webinar that happened a few weeks back. This is a great tool that you'll be able to pull up all the information about your school, about your area, your district, throughout the entire United States. So all of the images I'm showing you are coming directly from that tool. I will let you know, okay, so that all of the little triangles on this map are associated only with OneSight clinics. Just because the mapping tool is brand new, we are working on getting all of our vision care services up there, and then we want to reach out to all of the other vision partners and make sure that all of the dots there represent all vision care services across the United States. So, as you can see, charitable, sustainable, and voucher programs cover a free pair of eyeglasses from it. The map on the bottom right hand that accept vouchers. For your reduced. Children are 50% some areas have large, so this is where you need
urban or rural settings. If you can please take a thank you, everyone.
that is a great care. Now I want to get you in your area. Optical shops. Is actually just have to tie that up and wrap vision into it. To work better. And to help you kind of work through that, I'm going to tell you
Slight delay with our and then switch it back to you, Lisa.
Okay, great.
And I apologize, everyone. Thank you so much for your patience. All right, Lisa.
All right. Just waiting for this. more of a Midwest area, you may have a voucher program, or you may have some stores that accept vouchers near you, or you may have a light blue charitable clinic, which we have up there in Montana and in a few other areas. So now I'm going to tell you a little bit more about each of those. Voucher programs typically support children whose families are within 200% of the federal poverty line. Vouchers can be provided for just an exam, just a pair of glasses, or both, and they're a good way to support children who live in an area with access to a vision clinic. So there are some voucher programs that support children who may be undocumented, who do not show they are within 200% of the federal poverty line, who do not have papers. However, they are strict doctor's office. Our option for you. Charitable models are typically a traveling resource that can provide free glasses to students in need. These models are more likely to show up in highly populated centers where doctors serving uninsured or Medicaid patients are at a minimum and children cannot be seen. Many times these clinics will show up at schools or in common areas and schedule appointments up to 5 months in advance. On that map that I showed you, anything that's in light blue was a one-site charitable clinic for 2016. I believe there was about 15. Non-sustainable programs, sustainability. Never make it there, 67%. And so we're saying 67% of children in our schools are not provided with the tools that they need to succeed best. 1% of what we learned is visual. So how do we get a doctor to them? A sustainable vision care model can be an add-on to the currently existing school-based health center approach. It provides another component to comprehensive health care that has previously been missed. And considering 80% of our learning is done visually, it's an area that requires attention and follow-up care in order to give our children the best possible education that we can provide to them. So I have another poll question for you, and this is poll question number 3, Tiara.
Okay, great. Thank you, Lisa. I just want to know, also the slides will be available after the presentation, so I do apologize that we may be having a short delay with our go-to today, but we appreciate your patience. So our third poll question is, how many of you currently have school-based health center in your district or community? If you can please answer yes or no. Thank you. Thank you so much, everyone. So, Lisa, we have 71% that said yes and 29% that said no. And if there's an issue, I'm going to control back to you.
All right, great. Okay, you're back to my screen?
That's perfect, thank you.
Fantastic. So that's great. So the majority of people on this call do have a school-based health center in their area. I think that school-based health centers are perfect places to add vision care, and I know there's a multiplicity of people working across the United States to make sure that this gets into state-by-state legislation, that vision centers can be an add-on to school-based health centers. By adding vision services in a school-based health center, really as a hub to the region, you can see children from all over the district, the region, or a rural area. So unlike a different form of care that may be in your health center, if you're talking about providing students in one specific school with primary care, because vision affects 1 out of 4, so we're saying 25% of students, you could actually reach across an entire district and take from outside of just that school alone. It's not like primary care that you might see every single student in multiple times throughout the year. You could see 25% of your entire student population within that health center year after year. So, for example, a typical school center, you may have a capacity of 30,000 children. And if so, then maybe within a certain district, the capacity of the vision center could be around 3,000 to 5,000 students a year. So if you have a school district of 20,000 students with a 25% need, remembering that the 1 out of 4 students diagnosed need, that would mean close to 5,000 students would get to utilize the school-based vision center. And remember, you should get your vision checked once a year. So prescriptions can change, and sometimes they can change rapidly. Those students should be coming in year after year. If somebody's glasses break and they have a high prescription, they could come back in immediately and see a doctor. A great part is that these centers can see students who are on Medicaid or uninsured children. The sustainability of the center is based on the unique pairing of Medicaid and uninsured patients and your state's Medicaid reimbursement rates. So what one site is doing right now is working with School-Based Health Alliance to provide an easy implementation plan to add vision services to currently existing school-based health centers. As part of this rollout, the School-Based Health Alliance Blueprint now has resources surrounding the planning for school-based vision centers. So I'm going to take you guys through some of these tools. They're all currently in the planning section of the blueprint. And if you're interested, please to me at Tiara with any other questions surrounding implementation, and we can schedule individual phone calls. So now let me show you what we have on the blueprint. All right, and can you still see my screen, or is there a delay, Tiara? I could describe a little bit where I am if there's a delay.
Actually, we're good to go. If everyone else have any issues, you can please feel free to chat me in the question box. But right now, I think we are okay.
Great. So just in case anyone's behind, I'm on the School-Based Health Alliance website. If you are a member of the website, you have access to the blueprint, and within the blueprint, you have access to these tools around school-based health centers. You've got expanding, implementing, planning, and a supplemental library. So I'm going to click on planning. This is where all of the school-based vision center documents are. School-based vision centers are in the beginning stages right now. They are popping up across the United States via different partners, sometimes not always reimbursed by Medicaid, sometimes they have private funds. There's a lot of different opportunities for them, and I think we're at a point where it's going to kick off and start to move quicker, start seeing more vision centers in more locations across the country. So I wanted to provide you with an opportunity to learn more about vision centers in schools, to look at some of the academic outcomes, to look at what it takes to put a vision center into schools, and to kind of understand the entire process a little bit better. So if you click on academic outcomes, which I did here, you'll see that there's a few articles here around academic outcomes of students and either farsightedness or nearsightedness, of having centers in schools, and then effects of providing free glasses on children's education. For example, one of them is uncorrected farsightedness linked to literacy deficits in preschoolers. There's actually one study that just came out, I believe it was a month ago, that describes how 4- and 5-year-olds with uncorrected hyperopia perform significantly worse on the test of preschool early literacy. So this suggests that children with uncorrected vision impairments fall behind their classmates at a very early age. So they've fallen behind before they've even really started their educational career. Take some time to look through these, to go over these articles. Like I said, if you have any questions, please feel free to reach out. There's also the mapping tool on here. As you'll see, there's a lot of different documents. Some of them are around vision, some of them are around school-based health centers as a whole, so you do have to dig through a little bit. But we've got the Alliance Vision Services mapping tool. So that mapping tool that I had told you about, we have created a document to help you get the best resources around vision care that you can. You'll see that there's mapping vision services. Right now, when you go into the mapping tool, it is not public to look at all the vision resources. We are working with School-Based Health Alliance to get vision resources up on that map. For the meantime, if you're interested and you want to learn more about your county, your town, your district, your state, you could follow these instructions. Shoot me an email. We could pull the locations for you and send it back and provide you with a PDF map version of services in your area. And if you would like more information on the services, data may be also available upon request and then could be used interactively with the tool. Okay. We also have the facility design standards. So when planning, you're going to want to see how much space you have in your vision center and what your space requirements are. We have the One-Site Sustainable Facility Program Design Standards. It is a document that is arranged for all school-based health centers on your size, how much capacity, how many students you would like to see. And we had an architect build this out to show what some of the dimensions would be. Some of the school-based health centers you could see or vision centers would range from 450 square feet all the way to 1,100 square feet. So this is going from a 1-lane vision center to a 4-lane vision center. To give you a little bit of background, 1 lane can typically see about 1.5 students per hour. If you have a 2-lane vision center, you could have 1 doctor and see 3 students per hour in a 2-lane vision center. Then there's also some information about partnership exploration. So like we talked about charitable, we talked about sustainable voucher programs. There's something that may interest one of you more than another topic. And if you go into some of the partnership resources, documents for partnership exploration, you can find more about the voucher program, overview, charitable programming, and context for all of those. We also have our school-based vision center confidentiality agreement on here, and some more operational resources around vision services, Medicaid RAP payment, vision care resources, staffing processes, what staff you would need for a vision center, their job descriptions, and then coding and billing information. So there's a lot to look at here. There's a lot that can get you started and kind of digging in and seeing what it might take to get vision services. And then once you get a grasp on that, you could contact me, contact School-Based Health Alliance, and learn a little bit more on what the next steps would be for implementation, for working in your state, for finding out whether you can get reimbursed for vision care programs in your state, for lobbying. We could work with you on all of that. And with that being said, I would like to know, and I'll kick it back over to you, Tiara, for questions. We moved through that pretty quickly. I talked quickly.
All right, we want to give everyone an opportunity. If you have any questions, please take time right now to enter them in a question box. Right now, Lisa, we don't have any questions at the moment, but we'd like to give everyone, again, please enter any questions that you may have within the question box. Thank you. Okay, Lisa, if you want to provide any additional information that you may have, I guess we'll give others just, a little more time to answer any questions, get their thoughts together. I know this is a lot of great information that you have provided us, and we are so thankful that you have led us to this blueprint with all these great resources. So again, if you have any questions, please answer those questions in the chat box.
Yeah, and I think the three-tiered approach really comes around being able to say what is best for my community, and is there a way to double up. For instance, if a charitable program is coming to your community, but you've got 3,000 kids that need to see a doctor, and that program can only see 1,500, maybe you work with a voucher program to get the extra kids out there so that you can get 100% of your kids who are referred into seeing an eye doctor. Or if your district is that big and you test that out the first year and you say, hey, we really have a better opportunity for kids to get in year after year, because we've got 3,000 kids who needed a pair of glasses this year, and we want to make sure that they're taken care of through the rest of their academic career. Maybe that's an opportunity to put a sustainable vision center in. So it's on a case-by-case basis. There's still a lot to learn about vision. I think working together and making sure that we can take the best care of our kids that we possibly can, and make sure that they have the best academic outcome and tools to be able to get to where they are is what we are all dedicated to. And I'd really love to hear any questions, any comments. If you have anything you would like to add or anything that you have learned around this outside of this webinar that you'd love to share, we're working on this together, and it'll be a part of the School-Based Health Alliance Conference in June as well this year.
Okay, great, Lisa. We do have a couple of questions if we have a moment.
Absolutely.
What ages are targeted for the exams? And second part of the question, are screenings utilized to identify those in need of the exams?
Absolutely. Yeah, so age ranges for exams, and on a state-by-state basis, vision screenings are performed differently. It might be kindergarten, first, third, and fifth grade, but exams should really be done annually. And because of the ability for a vision center to see patients across the entire district and across more schools, you could see kids from K through 12, and you could see them across all schools in your district depending on the capacity of your vision center. Screening-wise, there should be a screening program in place at any of the schools you work with. For example, some of the schools that we're currently working with on school-based health centers have their typical annual screenings. I know in the state of Ohio, for instance, you need to have all your screenings done by November 1st. Once those kids are screened, the nurse will then either refer them to the school-based vision center because they're in need, they fit the 200% below the poverty line or within the poverty line, or they are undocumented and they know they can get a pair of glasses there. Or they'll refer a child who might have insurance, who can go to that center, but they know that the parent will not be able to take them. So they do it on a first-come, first-served basis. And then students that they know will be able to see a doctor, they'll just refer their parents to the doctor outside the school. That is because their capacity is a little bit less. Over time, they'd like to be able to see every student that needs to go to an eye doctor to make it that comprehensive one-stop shop approach. So every school should have a screening. Screening programs are done differently state by state. You can work with volunteer organizations to help out with that screening. If you wanted to enhance the screening and do it on a yearly basis or every other year basis for every single student, I know many schools do not incorporate high school into those screenings, but you could work with volunteer organizations to make sure that they do get screened so that the kids coming to the Vision Center are the most need. We've had great success with the screening programs. One site does have a screening program that we use and can train others on, and that is showing about 75% of students who show up in the school-based vision centers do need a pair of glasses, which is great. You want to get the kids in there who need a pair of glasses and be able to fill up your appointments with those kids that need it most.
Thank you, Lisa. Who provides the screening?
It can be school nurses, so school nurses should provide the screenings if it's mandatory in your area. Screenings can also be provided by volunteer organizations like the Lions Club, different one-site volunteers throughout the areas. You could work with corporations in your area if they're interested in helping out with students. Typically, vision screening programs are very easy to train on and to get good results on. All you would need would an expert in your area to be able to train a group of individuals to go out on screenings. For example, in Cincinnati, Luxottica, who's a corporation here and who's actually the founding sponsor of One Site, does a Cincinnati public school vision screening and sends out volunteers to every Cincinnati public school in the area. The volunteers work with all the school nurses to ensure that every child gets screened, that provide the school nurses with the results, and the school nurse makes the referral center.
Great, thank you so much. Do we have a time for another question before you move on?
We do.
Okay, great. As far as sustainability, are there any startup grants out there?
That's a great question. I'm doing some research into some startup grants, but OneSite is a charitable organization. We work with different community partners, FQHCs, and schools to provide access to those grants or to provide grant funding. So we do have some grant funding opportunities, which we've done when working with schools in Ohio and New York, and we're looking to provide more. So if you're interested in more, I'm doing research on that. And I also have some opportunities for some school-based vision center grants, and I would encourage you to reach out to me, and I can help you work through that, or help you work through the OneSite grant process as well.
Thank you so much, Lisa. That's all the questions that we have at the moment, if you want to continue.
Great. Well, that is actually the end of my presentation. I moved through it rather quickly today. I apologize for my quick I think my grandparents in their New Yorker style trained me to speak pretty quickly. So if anyone has any other questions, you're welcome to ask. We do have one more poll question for you at the end. And then, like I said, don't hesitate to reach out and send any emails, give me a call, provide any other questions after this call as well.
All right, great, thank you. Like Lisa said, we do have another poll question for you. Of charitable, voucher, and sustainable school-based vision center programs, which one most interests you? If you can just take a couple of minutes to please answer the question. Thank you. And also during this time while others are answering the poll question, we'd like to still give you the opportunity to enter any questions that you may have into the question box. Thank you. All right, 83% said school-based vision.
Awesome. Obviously, that was the focus, the end focus. I think that for voucher and charitable programs, like I said, there's a way to connect them all together, and I really think it is a three-tiered approach. If anyone is interested in learning more about school-based vision and host a charitable clinic in their community, maybe to see what sort of needs you come out with, or to test a screening model to get them to charitable, or if anybody would like to test a screening model to go to a voucher program. I think that's a great first step to getting school-based vision care services. I think it's a great first step in researching your community's area a little bit better, and I can provide you with more information on that or connect you to the right resource within OneSite or within other vision resources for you to be able to support your students the best you can. Were there any other questions, Tiara?
Yes, there is. In our state, we are in someone's state, Rachel, we are mandated through local public health to provide screenings for all preschool and school age at no charge. How do you see your program working with local and state mandates?
Yep. Local and state mandates are something you do have to work through on a state-by-state basis. So I think from the question you said you're talking about screenings, right? Not exams?
Yes.
Screenings. So screenings that is a state mandate in many states that screenings are for, there's no charge to the student and it has to be done in certain grades. Where the charge or the Medicaid reimbursement comes into play is when you're actually getting a full-fledged vision exam. So when you take that step up and you get the vision exam. State by state, it's completely different. As we all know with Medicaid, you may have one state that has a wraparound rate that'll give you a higher reimbursement, whereas you may have another state that does an alternate payment model. I know the state of Oregon has worked with alternate payment models, and their health center has been very successful. So it's something that you would just have to work through on state level. And again, if I knew this, if you wanted to run that through, we could do some research on that. I could work with you to make sure that you knew what your state needed best. But in terms of screening-wise, screenings typically are free of charge for the student. You will not get, if you do get a reimbursement, it will not be a huge reimbursement, or get a reimbursement at all for it, but it's the exam that actually will get you the reimbursement. And in some states, if you get an exam reimbursement, you may, and the child does need a pair of glasses, you may also get a separate dispense reimbursement, which is a benefit of having children who need it most come into that vision center. And that really keeps the sustainability of the vision center and the school-based health center running as a whole.
Thank you so much, Lisa. Right now, we do want to give others, we still have a few minutes, and we do want to give you the opportunity. If you have any questions, I know this has been great information. We thank you so much, Lisa. If you could please enter those questions within the question box. We do have a few questions, poll questions that we would like to ask everyone. If you can just take a few minutes to answer each question. And our first question is, we'd like to know, did this presentation meet your needs? If you can please answer yes or no. Thank you, everyone. Our next question is, how well did the presentation meet the stated objectives? If you can please take us a minute to answer the question. Again, thank you. Our third question, how likely are you to apply information from this presentation in your organization? If you can please take a minute. Thank you, everyone. And our final poll question, would you recommend this webinar to others? If you can please take a minute to answer the question. Again, thank you, everyone. We do not have any additional questions at the moment. Is there anything you would like to add, Lisa, before we conclude the presentation?
That is all I've got. I'll give everyone back their 15 minutes.
All right, well, we appreciate everything, and we thank you, everyone, for attending today's webinar. If you have any questions or additional information, you can please email us at School-Based Health Alliance, and we appreciate everyone today, and have a wonderful day.
Thank you.